He's a current board member of the Maryland University of Integrative Medicine. He has 14 integrated practices in the DC area, and he works with the Washington Capitals, the Wizards, the men's and women's US Olympic basketball teams, and he's here to talk to you about all the things that are changing in Washington right now. Please give a warm welcome to Dr. John Rosa.
So we'll follow on that. That's the how great I am slide. I'm really not that great. I am exactly the same as anybody else in this place. It's just that I love shaking cages. I'm going to give you a little bit of a presentation, a background of what's going on. A lot of you already, how many people have heard that there's an opioid crisis? I don't see every hand. Keep them up for me. How many people know we're in a crisis? All right. How many people know someone personally that has been affected by the crisis? So that's more than half the room. How many people are affected by the crisis themselves? Now, I never get a hand that raises when I ask that question. And based on percentages, I know it's absolutely impossible. And part of it is that stigma that goes along with this crisis and why we're in such a big bubble of the deaths increasing every day is because no one likes to admit it, no one wants to talk about it, and we're very aware that we have a problem, but we're not self-aware that we may be able to either be in it or be part of the solution. So I'm going to give you some statistical data. I think now I see why you worked the room a little bit down here. Slides are flying. An average day in the United States. I want to fire hose you with some data and some of the things that are coming out literally on a weekly basis on some of the stuff that I'm doing at a federal level. We're getting numbers for 2018, and there's some things that you may not even be aware of, and some of the stuff that's actually different from this slide that was made about 30 days ago. This is the 30th lecture I've done in 2 months. So I have a range of 20 minutes to 6 hours. I'm going to try to fire hose you guys in within a shorter period of time. This is pretty bad. It's an eye-awakening when you look at 650,000 prescriptions. And remember what I'm talking about is in one 24-hour period. It's one day. 4,000 people start non-medical use of an opioid. 600 start heroin use, 3,300 visits to an ER, 58 babies born addicted, 120 die of opioid overdose, which is actually higher than what you'll see reported and lower than what was just reported to us at a federal level. 60 deaths are related to fentanyl. That's a new statistic that just came out. And what you hear, you're going to start hearing a lot of chatter that is coming through the drug companies of it's not on us anymore, it's because of fentanyl. When 80% of a population that is addicted to heroin started with a prescription medication, if anybody says it's fentanyl's fault, you have my permission to smack them. Because that's just, you know, creating a false identity to the crisis. The stats, Mike had spoke a little bit about what the numbers look like, but when I look at those numbers on a daily basis, there's reasons why they're way off. The drug driving deaths, in a lot of states, they don't get reported. It's a crash, they died of whatever internal injuries, and we don't report that they were on a medication that happened. I mean, how many people remember the story about Tiger Woods sitting on the side of the road, and they pulled over, and they said he was drunk as a skunk, and they go and did some testing, and there was nothing there, but he was on like 3 different opioid medications at the time, and he couldn't even get behind the wheel. He was passed out on the side of the road. Drug-related gun deaths, sometimes they're reported as homicides or drug deaths. How you doing? So the numbers statistically, and overdose versus suicide, if somebody has a mental health diagnosis in their file, and this happens a lot through the VA system, which I'll get, this is another number that had just come out recently, which I'll share with you in a further slide. But if you have a mental health diagnosis in your file and you're polymedicated, which means they'll give you medications for PTSD or depression or anxiety, and then you're taking an opioid as well, you die of an overdose, but you're your file is going to clinically say you committed suicide. And it's not all the time, but it's enough in the numbers that aren't affecting what you see. 1 in 10 seeking help. The fact that not many people will ask for help. There's a lot of things going on with the other 90% of the people that are on these drugs aren't reporting to us. Massive distribution of Narcan. Now, in every state, at a federal and state level, we have pushed so hard to get Narcan in everyone's hands, which is a miracle saver, a drug that saves somebody who's in the deep throes of an overdose. Now, what happens with an opioid medication, it fills up so many receptors, but we have receptors for opioids in our gut, hence the drug companies making more money on constipation drugs. We have opioid receptors in the brain, the peripheral nervous system, the brain stem. And the brain stem is what controls our breathing, and hence why people pass, because there's so much of it that controls or deadens its ability. But the Narcan, when you inject it or take it through the nasal cavity, it pushes all of the stuff out and replaces it and gets you, essentially revives you with the ability to breathe again. Now that's great, right? I mean, isn't that nice? It's all over the place. But isn't it going to show now what we're seeing statistically? We push so hard, and now there was an expert that came into a meeting that we had at the White House and said, please let us be careful about how much of this is out there, because their drug buddies are now getting as much of it as they can. They're chasing that high, they're doing it, and they're doing it separately so that in case they disappear, they can shoot each other up with this Narcan. So it's now giving them a little bit of a play on, you know, let's do this together because we won't die from it. So it's actually kind of having a little bit of a rebound. Again, none of this is all across the board, but these are the pieces that we look at statistically because it has an effect on those numbers. That 2017 estimate, how many people we're losing to this crisis, he brought up Vietnam. The statistics are actually 8 years that Vietnam was a long war. We were there for 8 years. Iraq was 8 years. Afghanistan is now 16 years. You combine all 3 of those wars, we lose more people to this problem every year than the combined effort of the last 3 wars that we've been in. A year. I like when I hear wow, right? Because what we need to do is get pissed off as a society and as people who are in healthcare, because the wow has to be there. You know, when I go and I'm lecturing about this and I do those same stats level, 5% of the world's, under 5% of the world's population, we consume over 90% of the opioids that are made, and 80% of people shooting up heroin say they started with a prescription medication. If we don't get pissed off, I mean, we're going to lose family members and friends or ourselves at some point in time. This CDC study is enough to smack all of us in the face, because you take a prescription of an opioid prescription one day, you have a 6% risk of that 1 year later you're still taking that medication. And a 2.9% risk that 3 years later you're taking that medication. Did anybody know that statistic existed? Because they're starting to curb this thing down, trying to prescribe only 7 days. I'm sure you've heard a lot of what states are doing, trying to restrict the prescribing, and everybody's squeezing things down. And they're prescribing for 7 days, but you just go back a week later and you get the next one, and you go back a week later and you get the next one. That's not fixing the problem. The number of scripts out there, it's a false read. They're actually very similar of what it used to be. It's they're counting the number of pills per prescription that have decreased. 8 days, 13.5%, 30 days, 30% we're still using. 30 days, how many people got a wisdom tooth pulled out? How many people went home with 30 days of Percocet? And you said, I don't need it, and they said, you may. 30 days. Now, my mother's generation, when that doctor said you had to take something, whether it made you throw up or fall on the floor or feel better, you took the damn thing till it was finished. How many people were put in a position to take 30 days worth of a medication for something that they should have never even been given in the first place, or maybe just a few days because, look, It's bad. If I'm in a car accident and I have a crush injury and half my leg is hanging off, if you don't give me something in the hospital, I'll hurt somebody, right? There's a reason the drugs were made. There's a reason why you have cancer pain, you have crush injuries, you have major surgeries, you have things that take place this is miraculous stuff, but it was put there for a reason until one day they decide to change the game. It's not okay that 30% of the people who took 30 days worth of a prescription a year later are still taking the medication. We know what it means to have an issue. Those things resolve. We're supposed to fix them. We're not supposed to hide them. We're supposed to fix them. Excuse me if I'm not yelling at you guys. I know you're looking at me like, I didn't do it. It wasn't me. I mean, I don't even write prescriptions. It wasn't me. I'm passionate about it for a reason. It's just, the deeper I get in, it's almost scary that I don't sleep at night because it's that ugly. So what are the health effects of the body? Like, I just want people to understand that this is not just an opioid crisis of people die. There's a lot of stuff that comes through the system that you may see of people who are not maybe addicted, but maybe they're dependent. And I hate that teeter-tottering look of dependency versus addiction, because they're kind of the same. But in my brain, I know that there's a lot of functional people. Now, you guys treat people for pain, and a lot of them come to you for it. And how many of them are on certain morphine equivalents of an opioid for chronic pain? But we're still, you know, we're still trying to get through the hump, and they say that they don't have an issue, but try to have them to come off of it. But these are some of the things as a result of being on it. Obviously, brain, sedation, depression, respiratory system depression, that's where most of the deaths occur from, immune system suppression, liver damage, nervous system, digestive. We know all injection sites, but we need to be cognizant of the fact that there's a lot of people on it. There's not just a lot of people dying. Statistics are just so ugly. I think it was Stalin who was saying about, well, all these deaths was just a statistic. When you talk about 120 people dying, this is what the insensitivity and almost, we're desensitized to. It's like, damn, we all know there's a problem. We got a problem. It's a lot of people. Oh, that sucks. And then we go back to our day. But what about that your neighbor was a 16-year-old girl. She's just beautiful. She was excellent in sports. She twists her ankle playing soccer. And you see this kid going from this unbelievable athlete, something starting to get fed. You look at her and say, what would happen to that cute girl? And then you find her on the floor in front of her house one day, and you go there and you call the ambulance. You're like, what the heck happened? And then you kind of don't want to say anything, and the parents are embarrassed. They don't even talk about it. And you know, in about 6 months later, you're at a funeral. That story I just said, I just completely made up. But doesn't that suck? Like, didn't that hurt you, what I just said? You have to think of every one of those as that's what they really are. Because 120 deaths is just not it's not affecting us anymore. But that's what's going on. These are the poor people that end up, yeah, I went through that list, if you look, of what happens to the body for a reason. Now you guys, you're gonna see people that are in the throes, and you want to also recognize some of the other things, that it's not just pain, but you can almost know, you know that, what was the word for the boards that we had to know? The cachexia, look of cachexia, remember that? Like the look of death, like you knew something was up with this person because they're either dying of cancer or there's something major going on. These people have the look of cachexia on them completely in a very short period of time. Look at these people. This sheriff department took the first bust for opioids and their last bust before they died. And the time frame from 01 to 08 is 7 years, and 6 years for the gentleman in the middle, 4 years, 1 year, and months. What it takes to take a person from a human being to somebody who morphs into just somebody else. If you don't understand at this stage of the game, looking at these pictures, that this is a disease, that these people, once they get caught in the throes of it, are suffering and can't come out, It's an absolute disease. They get sucked in so deep, so hard, so far, that this is who they are. Look at it and look at it hard and understand why you need to be part of a solution. This can't be. They were alive when these shots were taken. All of them are no longer with us. Broken families, broken relationships, broken friendships, theft, incarceration, rape, depression, suicide. This is all what happens. How many people, a lot of these people, their parents know what's going on. Eventually they're sick of it. You're stealing from me, kicked out of the house. Your brothers and sisters tell you to go screw because you robbed them blind. There's no one else left. Everybody's embarrassed about it. You end up on your drug dealer's couch, and that's not where you live.